GoWorks as an organization started 3 years back. It's an Indian company which is focused on giving a virtual office, giving you an experience of everything which is required in today's organizations, giving you private studios, desk, whatever kind of workspace you require for your need. I believe some of the things which have worked well is support groups. In my previous organizations, we had formed support groups for a certain kind of issue which people face, and that worked very well. It started with a women's group, then it moved to people who are coming back to work and how they cope up with. We took the help of creating a mentor who will work with these groups to drive some of these issues home, to address these issues better. We did a huge amount of communication in terms of that this is not a taboo. We shared stories, obviously as confidentially we could, and we spoke to people about what others, their colleagues have gone through. And that's something which helped because employees started becoming more open to discuss some of these things. Training helped in a big way because managers started getting more accustomed, tuned to how should they respond to a certain situation, what kind of support groups they have. What needed more work was helpline somehow didn't work. We had less than 1% usage. I'm not sure if that's seen any traction. The work policies around some of these situations are still not clear. How do you handle a situation when somebody who is a high performer suddenly goes off the boat? How do you manage that? One of the things which still not clear, and there is a lot of ambiguity and a lot of discussion, is harassment beyond sexual harassment. Sexual harassment, a lot has been done by the government. There's statutory definitions of that. There is a lot of training programs, but there is workplace harassment which still doesn't call out. A lot of times I've seen managers giving calls to their team members, setting up meetings deliberately on Saturdays, Sundays, holidays, late at night, early morning. When managers start getting to personal space, how do you define that as harassment? These are some of the challenges which still exists, and probably we need some support on driving it home.
I essentially feel that we need to look at HR as an organization of the future. I work for Marsh & McLennan India, which is a part of Marsh & McLennan companies globally, which is a $20 billion organization. In India, we are about 2,000 colleagues in our global in-house center. And our gender diversity, just from a data perspective, overall is 54 to 46 women is to men. But at the senior management level, it's 27 to 73. I think in both these areas, primary challenges faced, especially on the health, well-being, mental health in particular, I think, is the external ecosystem. Especially in the Indian context, the external ecosystem is quite a bit of challenge with the government, civic bodies, and the general social milieu, causing a lot of drag, a lot of frictional energy lost in terms of trying to move the agenda forward. We talk about diversity. LGBTQ as an agenda has been decriminalized only a few years back, and that too by the judiciary, not by the legislature. The second challenge I found is in reliable service providers, and especially today in a scenario which COVID is bringing about, and I'm sure it's going to stay in one shape and form in terms of being able to work from anywhere, is how do we provide reliable services to our colleagues wherever they're working from. And the third point is connected, which is essentially saying that how when people get into our offices, right, or when they get into, let's say, CoWorks as an example, there is a controlled environment. You know that we can reach out to our colleagues, we can help them out in certain ways. There are infrastructures in place that we can pull together. One of the challenges in a distributed workforce model is that how do I ensure a controlled, managed infrastructure to all my colleagues wherever they are working from, so that the experience is uniform. Mental health, extending to previously what's been mentioned, is it's not talked about. It's a taboo. It's not recognized, the biggest problem. And from my industry perspective, as you will all know or may not know, is that it's not even insured. Treatment for mental illness is not insured. Now, which itself says that if it's not recognized and talked about, insurance comes a lot later. So those are challenges on the health well-being front. When I come to the gender neutrality space, I think life-changing events and how do we help our women colleagues overcome those life-changing events, get back into the mainstream of work is what is the real challenge. If you look at broadly from the numbers, the diversity ratios I showed you, we lose about 50% female colleagues from the initial levels of their career when it comes to moving to middle and senior management. And that's a huge loss. Our expectations from any solutions, because this is a startup community, right, in some sense. I was thinking about what it could be. And these are really the top highlights. We expect a solution for anything to be reliable, to be extremely simple and user friendly, human centric for sure, because if the UX isn't great, nobody is going to adopt that application or technology, whatever that might, and connected to other apps, to the work systems between two different applications and across multiple platforms and ecosystems. Now, I'll come to the last two, which I think is very important. Gamified and analytics of behavior. Any solution coming through should potentially have some form of gamification or tracking done of how the usage of that application for a health purpose, whether it's mental health, physical health, financial well-being, is helping people change behaviors for the better. So it's not about saying the person walked so many steps. What I want to know is if there is a physical well-being app, how many people, what percentage of my organization really change their behavior to actually become more regular with exercises and physical well-being? Or if you're looking at mental well-being, what from a person's working style, responses, interactions can I pick up, which tells me that a person is either on the verge of snapping or the person is really doing well mentally. So those are some of my quick thoughts on it.